I want to clear up 3 misconceptions about patient advocacy. Number one, don't only terminal patients need an advocate? Absolutely not. Everyone needs an advocate. And thankfully, when you're healthy, you can be your own advocate. But when someone's been diagnosed with a serious illness like cancer or MS or Alzheimer's, honestly, the list goes on, then having someone in your corner is critical. And I'll explain why in a minute. Number two, but isn't the doctor or nurse my advocate? Well, yes, they absolutely can be the patient's advocate. And honestly, many will speak up on behalf of the patient and they do a fantastic job. However, I want you to keep in mind that doctors and nurses have a lot of patients to take care of. For example, in a hospital, the general ward, a nurse could have 5 or 7 patients that they're managing. And a doctor, well, they can have between 15 and 20. So that's a lot of patients that they're taking care of. They're managing their medications and keeping track of what's going on. So if a patient has one person at the very minimum, hopefully they have more, that is looking out for them, that is going to make a big difference in the type of care they get. And the last question I get is, well, exactly what does an advocate do? Well, they do a lot of things, but most importantly, they are the voice of the patient. And they can be the voice in so many different ways. First of all, they can ask really great questions so everyone is aligned and they know what is going on. Keep in mind that a lot of times when someone is seriously ill, they might be on medications that make them a little loopy or forgetful, groggy, tired. So having someone who is alert and healthy and can keep track of what's going on, that is critical to helping them get the care that they deserve. They also can give pushback. Let's say the patient doesn't agree with next steps or they're concerned. Well, that's where an advocate can step up and really be a voice for them. They can use their listening skills to make sure everyone understands what is going on. They can catch mistakes. Keep in mind that doctors and nurses, they're human. It doesn't make them a bad doctor or nurse because they make a mistake, right? We all make mistakes at work. Just unfortunately, in their line of work, it could cost someone their life or make them really sick. So it's important that you have someone that's sitting there paying attention, listening, and knows exactly what should be happening. They also can keep track of the disease and the medication and what's supposed to be going on. And they also can ensure that the healthcare provider knows what the patient wants. So there are so many things, I've only mentioned a few, of why patient advocates are so important. So quick recap. Number one, everyone needs an advocate, not just terminal patients. Number two, doctors and nurses can certainly advocate for the patient, and most will, but you still need a dedicated family member or friend, one at the very least, to speak up on your behalf and support you. And number three, advocates can make a huge difference in a patient's care. So they're not just surviving, but they're thriving throughout this health journey. I hope that helps. Have a badass day.